Good morning, everyone. Welcome to the Spaulding-Harvard Traumatic Brain Injury Model Systems Summit on improving access to post-acute care for people with severe traumatic brain injury, a call to action. I'm Joe Giacino. I'm professor of physical medicine and rehabilitation here at Harvard Medical School, and I'm the project director for the Spaulding-Harvard Traumatic Brain Injury Model System. I'll be your host for the day. For those interested, we have closed captioning available. To activate this feature on your Zoom, click the Show Captions button that should be along the Zoom navigation bar at the bottom of your screen. Or if you have a different instance of Zoom, you can click the More button and that will open captions. And then once that happens, just select the language that you prefer. Before we start, I want to acknowledge and recognize the talented and industrious team responsible for planning and assembling this event. My deepest thanks to all of you. This was a monumental undertaking. Thank you so much. I also want to acknowledge our funding agency, the National Institute on Disability, Independent Living and Rehabilitation Research, or NIDLR for short. NIDLR supports disability and rehabilitation research, including the TBI Model System Program. I want to give special thanks to our project officer, Dr. Kate Miller. Okay, so why are we here? In short, to help people like Dylan, who you see on your screen. Dylan had a severe traumatic brain injury at the age of 19 years old. Our job is to get him back to his life. With appropriate resources, Dylan succeeded, as is evident in these pictures. What are we aspiring to do today and going forward? Existing regulations and policies governing inpatient brain injury rehabilitation programs are not evidence-based, and they don't align well with patient needs. We need to bridge the gap between evidence and policy so we can close the abyss that exists right now between acute and post-acute care. In 2016, the Spaulding-Harvard TBI model system took the first step toward mobilizing key TBI stakeholders to establish an action plan to promote more equitable access to rehabilitation aimed at reducing disability and the accompanying social and financial burden of long-term care. This initiative led to the development of a policy briefing book, which you see at the bottom left of your screen, which was actually cited in the 2022 National Academy of Science, Engineering, and Medicine TBI Roadmap Report, which you will hear about a little bit later. Step 2 occurred in 2022 when NIDLR sponsored a think tank meeting that focused on building evidence-based systems of care and policy to resolve the healthcare disparities that currently exist for persons with severe TBI, including those with disorders of consciousness, in other words, the most severely injured individuals. The think tank discussions included a critical analysis of health service delivery pathways in the US and concluded that the current system is highly fragmented with multiple pitfalls along each setting of care, as depicted in this infographic. Unfortunately, circumstances have become even more dire. Fewer people with severe TBI ever receive authorization for admission to inpatient rehabilitation than before. This leads to significant consequences, both clinically and for research. You may not be aware, but about less than 15% of individuals with moderate to severe TBI in the US ever have the opportunity to receive inpatient rehabilitation. So today's summit is intended to shine a light on these problems and foster engagement, particularly with our federal partners, many of whom are on will be in the Zoom today, to reassess and optimize healthcare regulations and service delivery mechanisms that impact people with severe TBI. Our objectives for the summit are ambitious. We want to begin by raising awareness of the long-term care needs faced by persons with severe TBI. We'll review the natural history of recovery from severe TBI, including recovery from disturbance in consciousness. We'll summarize the role of inpatient rehabilitation and the factors that impact its effectiveness and ultimately outcome. We'll assess existing health service delivery pathways. We'll identify inequities in national healthcare policies that impede access to inpatient rehabilitation. Very importantly, we'll share perspectives of those with lived experience about accessing inpatient brain injury rehabilitation programs. And this, again, will come from their own experience. We'll discuss existing successful partnerships between providers, scientists, and federal agencies in building accessible pathways for rehabilitation care. And this will include some of our international colleagues who have been successful in doing so. And then lastly, our objective is to collaborate with federal and state agencies to achieve more equitable access to high quality post-acute healthcare. Okay, now it is my distinct honor to welcome Dr. Don Berwick, President Emeritus of the Institute for Healthcare Improvement, the former administrator of the Centers for Medicare and Medicaid Services under President Obama, and chair of the National Academy of Science, Engineering, and Medicine Committee on accelerating progress in TBI research and care. Dr. Berwick is widely viewed as a leading voice on healthcare quality and improvement. He's graciously agreed to join us to share his perspective on the issues we'll be discussing today. Welcome, Dr. Berwick.
Thank you, Dr. Giacino. I will take only a couple minutes to connect my work to what's going on here. And I get to join my friend Jeff Manley later this morning to dive into a little more detail. My connection to the work you're examining here was new in my life. Back in about 2015, I was asked to chair the committee that Joe mentioned, the National Academy of Sciences Committee to accelerate progress in TBI research and care. I was a newcomer to the field. I was practicing pediatrician in my history, but not an expert in neurosciences or certainly brain injury. But entering that role was one of the real privileges of my career. I got to meet an enormous community of experts that really is unusual, even among the many experts I get to deal with in other fields, a community of experts deeply dedicated to the well-being of patients with traumatic brain injury, and moreover, willing to work together in ways that I found extraordinarily compelling. Teamwork, multidisciplinary approaches, a real sense of purpose. Equally important, we got to hear from patients. In the work of the committee, we had testimony from both people experiencing TBI and their families, and it was absolutely riveting to hear their experiences. On the positive side, some of the dramatic successes in care that have taken place under the leadership of Dr. Giacino, Dr. Manley, and others, but also a cry for help. The patients and families told us a lot about defects in the TBI care world, defects of continuity, a sense of being forgotten once they were past the acute phase of their illness, gaps in access to proper rehabilitation, mental health services, awareness in the public of the nature of TBI, and much else. Our committee ended up issuing a set of recommendations, which Dr. Manley and I will review later this morning, and they're all important from my viewpoint. But one of the absolute keys in what we noticed has to do with the content of this summit. To summarize, it seemed to be that the more severe one's injury, the less access one has to evidence-based inpatient and other rehabilitative services. There's a gap between knowledge and action. It's a chasm, as Joe's slide showed. We laid out a lot of agendas for action, but among the many, this is one that seemed ready for action. Why should we not have a healthcare system which uses evidence, especially evidence as strong as has been accumulated about the value of post-acute services, even for people with pretty dramatic brain injuries? So we are working ahead. The committee has now transformed into a forum on traumatic brain injury, which I have the privilege of co-chairing with Dr. Corinne Piquesa. The forum has attracted attention from so many stakeholders in the field. We meet regularly, virtually and in person. Dr. Giacino, Dr. Manley, and others are active leaders in the forum work. So we now have a platform for action that I think can apply across all the recommendations of our committee and beyond, but also be a very strong voice for remedying this gap between evidence and action. I'm grateful to all of you for having come together in this pursuit. I'm going to stay with this and do everything I can to help. And it's exactly the right thing to do, in my view, to pull together people for the summit that Dr. Giacino and his colleagues have arranged. So, Dr. Giacino, thank you for letting me sit in. I'm going to sit through the morning. I'm going to join Jeff later this morning, and I really look forward to being as helpful as I can be.
Thanks so much, Don, for setting the stage for us and for taking the time out